Good evening, everyone, again, and welcome so much to tonight's Healthcare Workers Care Network webinar, really looking at the impact on our relationships during COVID-19. Tonight, we have a wonderful lineup of speakers, and we really are excited to get the discussion going. I think also just to go through with everyone some of the general housekeeping rules for every Zoom. Please switch your cameras off and keep muted. The session will be recorded, as well as the slides will be shared, and the recording link will be uploaded to the Healthcare Workers Care Network, normally within 24 to 48 hours, but we say 72 hours to make sure that we're safe. There will also be a link that will be shared towards the end of the session where you're able to apply for the CPD points. So please do look out for the link. We will also be sending this out via an emailer towards the end of the week. That you're able to fill in. We do cross-check as well as part of the protocol with CPD points on how long you were on the session for, and if you benefited and enjoyed the session. So please do look out for that. Please follow us on our Healthcare Workers Care Network social media platforms. We have a Twitter page and a Facebook page. And something a little bit different that we're going to try out, we'd like to launch a quick poll. And as we see people joining the session tonight, we'd really love to hear from you. So you should be seeing on your screens right now a pop-up window that wants you to vote. We want you to let us know how your relationships have been affected and which relationships in your life have been impacted by COVID the most. And as you can see live, people are filling it in, so thank you. We're going to keep this up for another minute quick as we gather the results. Just a reminder, please, to mute. Okay, 10 more seconds and then we're going to close the poll. Thank you to everyone that is filling it in. Okay, thank you very much. Without further ado, I'd like to hand over this evening to Dr. Antoinette Merge, one of the coordinators for the Healthcare Workers Care Network, just to give us a bit of an update. Over to you, Antoinette.
Thanks, Cassie. Just in terms of the poll, I think this webinar will be very timely. It seems like most of you have indicated that sorry, I'm just muting someone, indicated that most relationships have been affected. I think that counts for me as well. I wanted to just briefly just say hello, say once again, thank you so much for all the support. June, July have been a busy month in terms of the number of requests. And if those of you who remember when I last showed a graph, where I showed the graph of the increasing requests for help in terms of the online forms, and then as it related to the COVID wave, the second wave, I haven't yet done the graph for this wave, but I think it's going to be the same. We've seen a spike of requests as the wave kind of started and passes. And yeah, so thank you so much. We're sitting on over 400 therapy sessions, which have been given by our volunteers. So thank you so much. And thank you so much to Cassie and the team for all the project management at SALAC. I'm going to hand over to Judith, who's going to be our MC for tonight. And thanks, Judith.
Well, thank you. It's really a pleasure to see you all and to see so many, as I said, old familiar names and some really lots of new names as well on the webinar. And to hopefully that this will be a space, obviously, to really touch on some of the complications and the challenges that COVID and the lockdowns have presented to our intimate relationships, our family relationships. And we are really lucky. We've got fabulous guest speakers. I will introduce each one of them before their presentation. If you have questions, please put them in the chat. And at the end of each of the three speakers, we will have an opportunity for the panel to convene and to go through some of your comments and your questions. So please feel free to put those into the chat. So it's really a privilege to introduce our first speaker. Catherine Frost is going to look at how COVID-19 has impacted on infants and young children and their parents and caregivers. There's probably nobody better who could speak about it. Catherine is an educational psychologist, and she was the executive director at the Ububele Educational and Psychotherapy Trust. And she's still, I believe, a senior psychologist there. And she developed the Baby Mat project and has parent and infant mental health as really an area of great expertise and speciality. And she's done enormous amounts in that field for our professional and our broader community as well. She trains and supervises professionals and lay members, lay counselors in infant mental health. So Catherine, over to you.
Thanks, Judith, and thank you so much for having me, everybody, and to being involved in this aspect of the Healthcare Workers Care Network. I'm going to share my screen. Okay, so I'm talking today about COVID and its impact on very early parent-infant and parent-child relationships. As Judith said, I'm still a part of Ububele and will be referring to Ububele and the work that Ububele does quite a lot, but I'm also a psychologist in private practice, so we'll be able to refer to that experience as well. Okay. So I don't know who listened to the radio this morning, but certainly children's mental health is at last really in the media, and it's on the agenda. And I think there's certainly widespread acknowledgement that it's a greatly troubling picture, that children's minds are taking a beating with COVID. And this really starts from the beginning. Just to give a little bit of an introduction to Ububele, that for those that don't know, Ububele is a non-profit organization based just outside Alexandra Township in Johannesburg. We have a focus on the first 1,000 days and children and their families, children up to the age of 10. And we're a training and service organization that works very much in the South African context and has developed programs for our particular communities. And we draw on attachment, psychodynamic, and developmental theories. There's just an image of Alexandra. On the right-hand side of your screen is a mum with small babies. And this is part of the work that Ububele does. And one of our home visitors in the bottom left of your screen doing home visits. So I wanted to really try and synthesize my presentation this evening into like 5 basic considerations for parenting young children in the pandemic, 5 basic ideas. And the first one is the first 1,000 days. Then I wanted to look at and think about with you the prenatal and birthing environment in the pandemic. Then what do the early weeks look like? And what does the holding environment look like, to use Winnicott's important concept? And then what is container contained? And that's Beyond's concept about the mind of the parents with very young children. And then the question, what about babies? And I just raise some interesting points about the circle of security metaphor and training around how exploration and hypervigilance have been interfering factors. So my talk today is really drawn from research, both bits and pieces of international research that I've come across, such as this interesting report, Maternal Mental Health During a Pandemic, which was done in the UK, as well as some local research. This was done by the NIDS CRAM team with Mark Tomlinson and others involved in it. And of course, my clinical experience as I suppose a frontline worker. I've been working at public hospitals, primary healthcare clinics, and been supervising my colleagues, both professionals, intern psychologists, and lay counselors who've been doing work with families with very small babies in this time. So in terms of the first 1,000 days, I'm sure all of you are familiar with this idea, and first 1,000 days really refers to the time from conception until a baby is 2 years old. And critically, within first 1,000 days is the development of attachment relationships. And as we know, that attachment is of critical import for all further aspects of development. And of course, attachment will be influenced by the mental health of caregivers. And just to quote here, since mental health constitutes a well-known predictor of child development and adaptation, more effort in understanding which factors are associated with psychopathology during the current pandemic is warranted. Okay, so within the first 1,000 days, we've really got the prenatal and the birthing environment to think about. And there's several important factors here that the pandemic has really raised. Of course, critically and centrally, maternal mental health. Then antenatal care. Then isolation, presence or absence or prohibiting of birthing companions and visitors, and hospitals as environments for birthing. And the effect of the COVID-19 pandemic has been showing a psychological impact on the mental health of pregnant women, highlighting the need for intervention. And previous studies on the effects of isolation on mental health and psychological well-being reported a high prevalence of psychological symptoms of distress. Interestingly, there are some exceptions to the negative picture. There have been some narratives of women that we've been helping that are actually reporting that having fewer visitors at the time of birth has allowed them to focus more on their baby. So I think it's an interesting aspect of restricted visitation in hospitals during this time. Just to carry on with this idea of prenatal and the birthing environment, research is showing that women have been shown to be the most vulnerable in this time, and that women have a disproportionate impact from the COVID-19 as well as the subsequent measures on those pregnant, giving birth, or at home with a baby or toddler. And that's from the Babies in Lockdown study of this year. Critically, and in this country particularly, such high levels of intimate partner violence and the escalation of that with high levels of stress, of course, has particular ramifications for very early relationships between babies and their parents. And of course, the high levels of toxic stress that have a neurological impact on babies' development is a really important consideration. I find these two concepts, Winnicott's holding environment and Beyond's notion of container contained, as really important to think about when thinking about parents. And I think they're a useful example or useful metaphors to use in this time, because of course the parents' minds create a holding environment for babies, and whether that's in a pandemic or otherwise, and the capacity to which a parent's mind is able to still have an ability to have reverie, to be able to regulate baby's affect, to be able to mentalize about baby's state of mind, will of course have a huge impact on baby's sense of safety, of baby's sense of developing self, and on the attachment relationships. But of course, what the pandemic is really showing us is that, and recent studies are indicating this, that there's been a substantial increase in the likelihood of maternal depression and anxiety during the COVID-19 pandemic, which really is then impacting upon the holding environment that the parents are creating for the baby as he or she arrives into the world, and could possibly contaminate their capacity for reverie and the important function of container contained. So literature shows that in similar disaster situations, mother's stress reaction and mental health have a critical impact on infant development. And we certainly are seeing an increase in maternal anxiety and an increase in maternal isolation. And in the Babies in Lockdown survey study of this year, many parents are speaking about the anxiety about the impact of the virus on the brain and mind of children. Whether this is accurate or not, there has been anxiety about that. And just to counteract some of the negative pictures, some surveys have reported on the positive impact of increased time with baby. So what about babies? And I found, thinking about the circle of security model, a useful one in really thinking about how babies have been affected in this time. For those of you that aren't familiar, the Circle of Security is an accredited parenting program, but it's an attachment-based theory that really speaks about the function of the parent as a secure base for the baby from which to explore, and that also function as a safe haven. But that the parent's state of mind is critical to be able to allow a child to do the ordinary exploring, as well as to be in a state of mind to receive a child should they feel anxious. And my hypothesis in reading some of this research about babies is that certainly there's been an increase in clinginess, crying, and tantrums, and that one can hypothesize that parents' anxiety in this time is inhibiting children's sense of safety and wish to explore, which is an appropriate and necessary part of development. This is an interesting book that I found useful really in thinking about how to work with children where there's been intimate partner violence or there's been violence between their parents. And those are some of the references, and certainly anyone can get hold of me for any of the other references that I've referred to today. I think critically what is coming through in the research that I've read, and certainly in our clinical experience, is the necessity for accessing support and to continue offering support in the hybrid ways that I think the Healthcare Workers Care Network is doing, and many other organizations such as SADAG and others that are really reaching out to families digitally and otherwise. And it's critically important that we don't forget about the perinatal period for parents as well as for unborn babies, and then for very young infants as well. And of course, for parents with their young children, parent-infant psychotherapy, under fives therapy, and therapy for children. Just to give Ububele's low-fee service for children a bit of a punt. And that really is what I have to say. I really look forward to hearing or engaging with any questions that people may have. And thank you once again for having me.
Well, thank you so much, Catherine, for that really sensitive and nuanced and comprehensive overview of what is a vast topic, but you've really made it digestible in ways that I think people can then go forward and explore and take up all those issues and those ideas, and look forward to what comes up in the chat and in the discussion. So thanks, Catherine. So now we move on quite rapidly, which is sort of how it feels when you become the parent of a teenager, is where did all the time go? But our next speaker, who's going to help us think about older kids and teenagers, is Natalie Solomon. And Natalie is a clinical psychologist who has an interest in attachment, trauma, interpersonal neurobiology, learning difficulties, depression and anxiety. And I know that Natalie has a lot of experience having worked and been involved with Bella Vista School, and now at the Children's Clinic and Ward at Tara Hospital. So it's really a pleasure to see you, Natalie, and over to you when slides start working.
Sorry, one moment. Perfect, great. Thank you, and good evening, everybody. So really, we all know that coronavirus pandemic has really wreaked havoc in all areas of our life. And our collective mental health has been another one of its heavily hit casualties. COVID-19 has introduced the loss of life, severe illness, unemployment, economic instability, and social isolation. And this moment is likely to define a generation. There are more than 2.2 billion children in the world who constitute approximately 28% of the world's population. And those aged between 10 to 19 years old make up 16% of the world's population. So COVID-19 really has impacted on the lives of adolescents in an unprecedented manner. It really is predicted that compared to adults, this pandemic may continue to have increased long-term adverse consequences on adolescents due to the increased vulnerability and the enduring imprint of this developmental period. Adolescence is a period of development involving a delicate interaction between biological and cognitive processes and unique environmental factors. And the pandemic and its associated experiences are likely to have a significant enduring effect on the maturing adolescent brain. We know that teenage brains are going through a significant and dynamic neural upgrade, making the brain acutely sensitive to the environment. And the three brain systems undergoing significant shifts during this time are the reward system, the relationship system, and the regulatory system, all of which have been either directly or indirectly impacted by the pandemic. Because the adolescent brain is particularly malleable and sensitive to experiences during this life stage, the pandemic is likely to have huge implications for the adolescent brain. So Pigiani in 2020, in a review of some early studies on adolescent mental health during COVID-19, notes that adolescents display an increased risk for mood alterations, irritability, insomnia, anger, confusion, grief, and emotional exhaustion, and feelings of boredom, loneliness, distress, frustration, and uncertainty are very common. Interestingly, Gusum et al. In 2020 notes that adolescents display increased risk for PTSD, increased risk for depressive anxiety symptoms. As we know, adolescents with a pre-morbid psychiatric history are especially at risk. Maybe it's due to disruption of care or COVID-19 related anxiety or difficulties in coping with confinement. And adolescents with OCD and health anxiety are suspected to be one of the most affected by this pandemic. So, while the exact nature and the extent of COVID-19 impact will be different for different individuals, and it's going to depend on the nature of the experience, on access to resources, and the impact of the after effects. But for everybody, there's been a common experience of kind of a prolonged chronic threat, which we can kind of understand as a micro threat. In the last 18 months, there's been a constant activation of our implicit and explicit memory systems that of experiences of chaos. And teenagers are exposed to a constant reminder of not feeling safe, not being able to count on things they used to, and everything associated with feelings of uncertainty and loss in the past gets reactivated in the present. And as a result, adolescents find themselves responding with hypervigilance and overreactivity. The ACE studies, which were conducted in the 1990s, were one of the largest investigations into the impact of childhood adverse effects on later life health and well-being. And it really brought to our attention the powerful impact that negative childhood experiences have on future health and functioning. It revealed that children who are exposed to adversity have long-term mental health and physiological consequences that can lead to chronic illness and even early death. So we're still unclear of the exact impact of the pandemic, but we do know that adversity during this particular life phase is significant and can have serious implications on both physical and mental well-being. So stress and stress activation are a demand on our body's physiology, which is part of everyday life, and our body does have stress response capabilities. But when stress is dramatic, ongoing, unpredictable, or life-threatening, stress response systems can be negatively impacted. And it's important for us to note that when teens are faced with trauma, previous trauma also gets activated. So there's chronic experience of adversity, and they're sensitizing our nervous system to more pronounced mental and physical health challenges in response to danger. We find ourselves placed in a state of defense as our autonomic nervous system is really sensitive to safety and threat cues and highly responsive to environmental conditions. And this type of sensitivity may retune our nervous system and actually alter threat responses to future dangers. It's interesting to note, even through our COVID-19 safety protocols that we've established to keep us safe, we've inadvertently placed our nervous systems into states of defense. So, for example, when we wear masks, we can't see smiles, or our voices are muffled and it sounds like we're yelling, or we may gesture in large ways to get our point across. And all of this is being read as dangerous to our nervous system, placing our bodies in states of high alert. So in response to the experience of the pandemic, teens are likely to exhibit a lack of stamina or fatigue, difficulty transitioning from one activity to another, feelings of dysregulation or disruptive behavior, withdrawn behavior, a lot of somatic responses, headaches and tummy aches, a lot of academic anxieties. They might have too much energy. Sleep and appetite disturbances are common. What we found is very interesting that in the absence of social interactions and social bonds, many teens seek substitutions to calm their nervous systems, such as drugs, food, or online shopping. And Dumas et al. In 2020 noticed that adolescents were in fact increasing their use of alcohol and cannabis during the pandemic, even though they are at home. So they note that this shows a significant link between lack of positive coping skills and the possible pathways that may associate stress with craving drug use. So although the rate of COVID-19 infection among young children and adolescents is low, the stress confronted by COVID-19 places teens in a very vulnerable position. We know adolescence is characterized by 4 key qualities, which is novelty seeking, changes in social engagement, increased emotional intensity, and changes in creative exploration. The pandemic has really placed strain on the development of all these key qualities. Teens are biologically driven to take risks, and it's not simply a lack of control. Risk-taking is actually important. It affords learning opportunities, it builds resilience, but the pandemic has interfered with this development, and it's almost robbed teens opportunities for healthy risk-taking behavior. Also for adolescents whose interactions with peers is so central to their lives and their development, the pandemic has really shrunk their world. And it's been especially difficult in quarantine. Increased time spent at home with family really challenges adolescents' intimacy and autonomy needs. There's a lot less privacy and there's few personal spaces. Adolescents also generally have experienced intense emotions with high frequency and volatility. And we know that the teen brain responds to hormones differently to that of the child and adult brain. In particular, we know the THP hormone, which is released in response to stress to modulate anxiety, actually has the reverse effect in adolescence, and it actually raises rather than tames the anxiety. So teens simply don't have the same tolerance for stress that adults do. And due to this exaggerated emotionality, COVID-19 related stresses will exacerbate this even further. We also, what's been noticed is significant changes in daily life schedule. Daily physical activity is low, mental activity levels are lower, food intake levels have shifted, sleep duration is all over the show, and there's unlimited screen time and circadian rhythm disturbances, as well as coupled with minimal exposure to sunlight, all of which have huge repercussions for the teen's brain and well-being. And Roy et al. Notes that the average screen time has increased during lockdown, with average screen time being 5 hours, and pre-lockdown data of screen time averaged 3.5 hours. And that's average. So I'm imagining what the higher side looks like. We also see the sleep duration of adolescence has increased because there's more time and there's a lack of clear structure. There's been a significant increase in food intake, and all of this has been impacting on their general well-being. So Barry Carpenter has gifted us with the concept of the recovery curriculum, and he notes that there's really 5 significant losses associated with the pandemic. There's a loss of routine, a loss of structure, a loss of friendship, a loss of opportunity, and a loss of freedom. And the loss of routine and structure that school and extramurals have given has been really taken away and created enormous anxiety. There's no infrastructure to the week, there's no rhythm to the week, leaving children feeling very overwhelmed. Lots of feelings around a loss of control, a loss of concentration, lots of frustration. There's been a loss of friendship and opportunity for social interaction, which can trigger in some teens a sense of bereavement. enormous feelings of loneliness and isolations. Interestingly, teens have missed the physical proximity with their friends. We imagined that they would make the migration onto online relationships fairly easily, but in fact, we realized they need 3D contact. And also many planned events and rites of passages have been missed. And this is very disappointing for adolescents. There's been a loss of freedom, which is incredibly constraining. And we know teens' self-image, their self-esteem, and their self-concept is located in interaction with peers. And they can't test their emerging self against the rules and routines of the family life. So from loss emanates 3 significant dynamics, which are anxiety, trauma, and bereavement. And all are incredibly powerful forces, and they're showing up significantly during this period. So really at a time when everything feels uncertain and our teens are looking to the adults in their lives for guidance and reassurance, which can be incredibly difficult because we ourselves are struggling to come to terms with this new normal. Bruce Perry notes that the difference between adversity and trauma is relationships. And so your history of connectedness is a better predictor of your health than your history of adversity. It really is important for us to connect with our teens to help them navigate these uncertain ways. And some of the ways we could do this is through routines and structure, predictability. Movement needs to be encouraged, even rhythmical physical exercise to regulate the body. Emotional mobilization is incredibly important. Help teens get involved in acts of service so that they feel like they have a sense of agency. And we need to allow our teens flexibility, control, and choices. They need, it's adaptive for them to have, to take control over environment that has felt incredibly out of control. So our work as adults in their lives is to provide containment, connection, to help develop their emotional literacy, and to try and install a sense of hope. While we acknowledge it's an incredibly difficult time, but maybe we frame the future with new opportunity and possibility. So while COVID has really introduced many stresses, it has also given us an opportunity to review some of our autopilot choices, and it's given us a space to think differently. Offers us an opportunity to restructure some of our systems, to explore what works or what doesn't work, what we'd like to keep and what we don't want to go back to doing. So maybe it's useful to end with the work of Charlie McKeesey from his book, The Boy, the Mole, and the Fox and the Horse. And he says, "There are dark clouds," said the boy. "Yes, but they will move on," said the horse. "The blue sky above never leaves." Thank you. Here's a list of references, and you're welcome to contact me, or I'm happy to give access to all of them for anybody who's interested. Thank you.
Hi, thank you so much, Natalie, for both that sobering, but also, again, very comprehensive overview. And sorry, am I unmuted? Yeah, I'm just checking that. And just what I found absolutely valuable was your quoting Bruce Perry about the value of connectedness and reminding that what we're talking about this evening is all about connections and their challenges and their failures and the hope that they also allow. And I was really fascinated by the idea of a recovery curriculum. And I hope that people will engage with that. A reminder to everyone to keep posting comments, questions, your experiences, the things you're wondering in the chat, and we'll come to that later. So thank you again, Natalie.
Thank you.
And so now it's my great pleasure to introduce our also a media star, Vuyo Themba, who's going to talk about what about love during lockdown? What's happened to the grown-ups? What's happened in intimate relationships? And I'm really, really pleased to introduce Vuyo Themba. Vuyo is a registered clinical psychologist and the founder of KTM Consulting. She has many, many years, even though she doesn't look it. She's got 20 years experience in the fields of psychology, human resources, operations management, and consulting in various fields, including appearances on media. And I think you're really well placed to help guide us in our thinking on this really challenging topic. So welcome, Vuyo.
Thank you, Judith. Good evening, everyone. Just need to share my screen as well. Good evening, everyone. I was actually very excited when I was asked to be part of this webinar, partly because I have benefited quite a lot last year from some of the webinars that were organized for us. And so I thought it'd be an honor to just also give back. And so what I'm going to share, I think it's placed from a number of places for me. It's stuff that it's things that I've been coming across in terms of the private practice, but also just some literature and research that one has been looking at, but also just, talking to people and just hearing how lockdown has also affected their relationships. Okay. I think we must all admit that managing a relationship even before COVID in itself was a lot of work. One, because relationships in themselves are very fragile, and so they just always need to be handled with a lot of care, because you have a number of two people that are involved, or multiple people that are involved, trying to work towards something common at some point. And so if we look at some of the pillars of a relationship, I mean, according to Steinberg, triangular theory, for us to enjoy a consummate love relationship, that for us to actually have that, it requires three pillars that all need to be present at the same time. The first being commitment. This is the trust that we show towards each other as partners. The aspect of intimacy. And what we refer to as intimacy is those aspects of our emotional and cognitive life that we share with others, but also it's when we start to develop interest in the other person's interests, and also just dividing the time, but also just the time that we take to commit towards our relationship. The third aspect that he speaks about is the area of passion that refers to mostly the physical, the sensual, emotional, spiritual activities that we often think bring the spark back into the relationship, or not even back, but the spark that we need for relationships to thrive. Esther Perel also speaks about the paradox of love. She asserts that love rests on two pillars. For her, it's about the two pillars, one being that of autonomy and the other being that of surrender. Our need for togetherness, she says, exists along our need for separatedness. One does not exist without the other. With too much distance, there can be no connection. But too much merging eradicates the separateness of two distinct individuals. Then there is nothing more to transcend, no bridge to walk on, no one to visit on the other side, and no other internal world enters when people become fused and they become one. And when COVID came, obviously, a lot of this was then tested, because we know relationships to be about time, about affection, about being together. And what happens then when time and togetherness are either removed or increased, which is what I think Esther speaks to, but also how do couples cope with challenges that they've never faced before. When COVID came, governments obviously had to respond, and the response to the pandemic, which was mostly by way of lockdowns, and these increased difficulties in relationships. Literature has found that there were difficulties that were seen in certain relationships. There was an increase in conflict and violence, especially at the beginning when we, particularly in South Africa, when we were in the hard lockdown. We saw high levels of partner violence, high levels of GBV, and a lot of conflict. And this could have been brought about by many reasons. Obviously, the proximity with which at which the couples were finding themselves, and those couples obviously who might not have already had certain or healthier habits to mitigate the impact of the challenges that they were going through at that time. Also, the lockdown meant that there were challenges to how we are adjusting in terms of the couple issues. And these adjustments that needed to be made obviously affected the relationship processes, including how partners spent time together, how they were talking to one another, how they were even managing conflict. And this was also seen to exacerbate tensions, and it called for couples to find and implement more effective coping strategies and mechanisms to deal with their relationships. Whilst for some, it was an opportunity to spend more time together at home, and this also brought some couples together. But there were also challenges that came with them spending time together, as Esther says, that in other instances, we're finding that couples were starting to merge, and couples were struggling also with negotiating their own individuality, because suddenly things were done together. A lot of us started dropping off the kids together, going grocery shopping together, doing a whole lot of things together. Whilst it was a means of us coming together as a couple and maintaining some semblance of normalcy, but it also meant that we were spending quite little time individually taking care of our own personal interest. What we also saw was that the time apart from partners, especially those essential workers and the retail workers who were now going out there and having to work whilst the other partner spent time at home or whilst they were indoors. Obviously, this also exacerbated the anxiety and the worry in those partners that were still at home or that were not out there. And they also, whilst they were faced with their own anxiety about their partners being exposed, they also had to deal with the likelihood of their own the danger or the risk of them even also being affected or infected by the people that were by their partners that were coming through from or were coming out from their workplaces. So whatever the specific situations, the dynamics in romantic relationships have been affected by COVID. And what the literature is telling us, what I found is that it's very mixed on what we assumed was happening out there. I think the assumption has always been that the COVID or the restrictions and the lockdown affected the relationships negatively only. But we're finding that in different parts of the world, people have been affected differently. I mean, in November, in the UK, it was found that 15% of Brits reported their romantic relationship either ended or became strained due to the coronavirus. But at the same time, 16% of Italians said they experienced romantic relationship becoming stronger during the pandemic. And I mean, there's many reasons why some of these relationships might have been stronger. Is one, the fact that if we are together, which means we are talking to the aspect of commitment, the aspects of passion, and the three aspects of what Steinbeck talks about as being what is required in the consummate relationship. A significant share of Europeans reported the crisis as having no impact on their relationship, and that was more or less around the same time. Whilst in the US, the initial data that came in showed that COVID had not caused widespread wreckage so far. And in fact, the few states that had released their divorce statistics at the time showed declines in divorce rates. And this could have been amongst those who saw an improvement in their relationship, particularly in the beginning of the pandemic, because they were spending more time together. Among some of the challenges that have also been documented with COVID, or the impact of COVID, is how couples have now had to renegotiate quality time together. Like I said earlier, it's that concept of autonomy, but at the same time, how do we maintain our own existence, but being together and being mindful of each other? Also navigating less personal space and time alone. A lot of the time what we found was that couples had to now, the home space became the workspace. It became spaces that are shared for everything. And as a result, there was less personal space for people, even in terms of just where people would have enjoyed that personal space by either driving to the office or working away from home and spending that time to reflect on their own processes. The absence of that now meant that people were no longer, or couples, at least some people in the couplings, were no longer enjoying that personal space and time alone. And so also what I noticed from most of the clients who were coming through was that when this time alone was required or demanded, a lot of them were now struggling to actually communicate or renegotiate because of their fear of how their partner would sort of take that, whether they would feel as if they are being rejected, or they would feel like the other partner is not appreciative of the time that they are spending. Also experiencing, a lot of the couples, individuals in the coupling, were experiencing anxiety and the stress prompted by the pandemic. And this is important because, remember, we have to think of what the individual brings into the coupling. And so if I have my own anxieties, if I have my own insecurities and many other things that we could be experiencing during this time, those will have an impact on how I show up in the relationship and in the coupling. And so those individuals that were experiencing a lot of anxiety and that were stress prompted, obviously it meant that that would then ultimately have an impact on their relationship and their ability to work with what was coming up in the relationship. Financial stress, that has been reported to be one of the biggest disruptors, I think, in terms of COVID in relationships, exacerbated by the loss of work, reduced work hours for lots of people. In our country specifically, we saw a lot of people having to take pay cuts, people who at some point thought they would never find themselves in that situation. And so when couples, where we know this also, even outside of COVID, that couples who struggled managing their finances or who presented in our offices with financial problems, most of the time there would have been other problems. But we found that at this point specifically, it had started to have an impact as either couples or families were no longer able to afford even the basic necessities. And obviously the last one that was documented, among some of the challenges, was the increases in the conflict. Most notably, Susan Choi says that most notably the high pressure environment of confinement combined with the financial stress brought about by a COVID-burdened economy has led rise in marital conflict. And this was also very particular. It related quite a lot to China and Japan. It was found to be the cause of the divorces there. So what are we learning? What we now know is that despite all that COVID has brought and the negative impact, but it hasn't quite killed romantic relationship, but it's just made navigating those relationships much more complicated. Another study actually found that younger people or people who are single were not actually, they had expected or they would have thought that they would be put down by the idea of COVID and would not be putting themselves out there. But actually the study found that people who were single were still looking for partners. Which was quite interesting, because then I think it talks to what Natalie was talking about earlier, to say that connection is critical. So despite our external environments, I think our innate need for connectedness and connection still remains. And what also was very interesting for me was how the pace at which people now were moving in terms of their romantic relationship was slightly different. One person on Twitter the other day said that I don't see the point of playing hard to get anymore. If I like you, I like you. We're going to do this and we're going to work on this relationship. So to some extent, where before we would have wanted the courting to take a bit of time, and we play hard to get some of the nuances that we would often see in new relationships, people were saying there is no need for that. I think now people were just cutting to the chase, which is a very interesting phenomenon. At an individual level, the pandemic has made people more stressed than ever. And like we said earlier, this has an impact on a couple's ability to be good partners to each other. But also one of the things that have come out of the other studies was that it was found that women in relationships took on a lot more of household responsibility, which sort of started showing shift towards traditional gender roles, even though couples were helping each other. But it was still picked up in the study that women still took on more. They took care of the kids, they took care of the household chores, and so in running their homes, they actually got to take on more in most cases. Uncertainties around partner commitment was also one of the things that we keep finding in the different studies, that people are now, or some partners, in some couples, people were starting to question what it means to be committed to a relationship compared to the previous idea of what that would have meant. So what is it that we can do to safeguard our relationships? Maybe before I also go there, to mention something that's also critical, it's, with losses, with a lot of losses that we have seen also as a result of the COVID, this has also had a lot of impact on the couple relationships, from the point where one of the partners would be sick as a result of COVID. It created a lot of anxiety in the romantic relationship, especially once the partner is healed, because there almost also seem to be this uncertainty of where do we move from here. I think with people who are staying together, it's slightly different, because they would sort of pace themselves to see how the other spouse is. But with people who sort of were staying separate, when we meet the first time after I've been quarantined, do we kiss, do we touch, what do we do? So there has also been a lot of anxiety in terms of just in cases where one of the partners or even both partners have actually contracted COVID, but also in terms of the losses that we've seen when one partner has lost their family, or it would often have a negative impact on the relationship, and it then called for the one partner to be there and supportive in most cases. So what is it that we can do to safeguard our relationships, or at least manage them in a way that helps us keep them still intact? One of the things, or some of the things, are to maintain some semblance of normalcy with routine. It's important, I think, as couples to stick to certain routines that we would have built for ourselves, whether it's that ride to take the kids to school, or it is that cup of coffee, or that good morning that we say every morning, the check-ins. Those things, as much as it might seem as if they are not big things, but it's the little things that mitigate for the impact of negative experiences within the relationships. Talking to our spouses as well, being sympathetic about their concerns. Often I found a lot of the partners who would have been affected, or particularly negatively, they become so inwardly focused that the idea of being there for the other person, they're not even aware that they're not even showing up for their partner in a way that they should. And so it's important that we talk to our spouses, but talk to them with the idea to understand what it is that they're going through, as opposed to always wanting to give advice. We need to remind ourselves of who we are and what we believe as a couple, but also reframing the situation in a more positive or a different way. Whether it's saying, instead of feeling like we are stuck together, but looking at that situation and appreciating the time that we are spending together, and how we are using that time to perhaps say we are discovering or finding ways to work on our relationship so that it becomes better. But also focusing on how things will be when the crisis is over. I think this is a big part around the idea of hopefulness, that when we do have hope, it sort of also helps. The Gottman Institute also speaks about having stress reducing conversation. I like this because it's very practical in how we can actually also apply it in our own relationships. And this is about discussing topics outside of the relationship, not anything between you, but including the kids. So it could be conversations about what is happening, but also, things that we would things that are not about us in the relationship, but more things that are happening, because it allows us to have that level of connectedness, as well as we hear each other's emotional experiences of these things, but also our cognitive experiences of them. We listen and empathize, offer emotional support, validate our partner's feelings based on how they experience the situation, even if we don't agree with them. And like I said earlier, we need to avoid giving unsolicited advice. Often we do that very easily because we're thinking, what is in the best interest of our partner? And at that time, we're quick to want to give advice. A lot of the times also our partners would come with their own frustrations from wherever they come from. And we need to also be mindful that in the relationship, we are partners. So it's important not to side with the enemy at this point. You are on their team. So when our partners come and they complain about what's been happening at work, yes, as much as at some point we might need to have a conversation about, but perhaps you yourself need to find a way to deal with it. It's to also understand and sort of be on their side so that they don't feel like everybody else is against them, including this, the epidemic, the virus itself. We need to establish rituals of connection. I spoke about this earlier, but also importantly is rekindling, finding ways to rekindle the romance and intimacy in the relationship. So as much as we locked in, we need to still be making the effort and being much more conscious about maintaining our relationships, because the work will not be done by anybody but ourselves, irrespective of COVID being in our midst. And maybe we'll leave it there for now. Thank you for the opportunity. And should there be questions and some of the references, I'm happy to provide those as well later.
Well, thank you, Vuyo. Yeah, wow. That, I mean, really, I could see a lot of discussion being generated around what's happening in couples. And I suppose it's something many of us are dealing with both professionally and personally. I know that now we're going to already thank you, Vuyo, for that. There was lots. I mean, I made lots and lots of notes. I love the idea of COVID as both a disruptor or catalyst in relationships. And I love the idea of stress-reducing conversations, which we can all really look towards. And it made me think of lots of things that I want to come to in our discussion. And maybe I can just ask to say thank you again to our speakers, but to ask Cassie to unmute, or to the speakers to unmute themselves, so we can maybe look at some of the comments. There's been a great deal. Cassie's been very good about WhatsApping them to me, so I can try and address them and create some kind of discussion going forward. And the first thought I had for Catherine, actually, and it was not something that came up on the chat, but I'm going to use it because I was fascinated. As you were talking, I wondered about what's happened to the pregnancy and birth rate internationally and in South Africa. And Catherine, I don't know if you've read anything about it or seen anything about the birth rate.
I haven't actually, Judith. I did come across a very interesting study that I didn't include, but it was about there's been an increased number of stillbirth deliveries, and this was an Italian study. So I really don't know if that finding has been anywhere else. And I don't know about the incidence of pregnancy, yeah.
Well, I looked it up because I'm such a nerd. And what I found is a study that said people thought that with all this lockdown, all this intimacy, as Vuyo was talking about, all this together time in the various lockdowns internationally, what they actually found, rather than there being a baby boom, that there's been the biggest slump in births in the USA and parts of Europe in many decades. That in fact, the rate of people falling pregnant, and I suppose this is largely the West, or, you know, I don't know exactly where it was, but it fascinated me that there seems to have been a reluctance for people who are planning families to engage in that during the pandemic, which was really interesting. And I wondered if that might become something in South Africa, but it was something fascinating.
I'd like to share anecdotally, well, I mean, from our clinical experience, and of course, this is just the work that I've done at Ububele, and in particular with our home visiting team who recruit pregnant mums for visiting. And I think in this time, a lot of that work's been done via phone or online as much as possible. But they've been talking about increases, actually, because I think a lot of people are not prioritizing going to clinics for family planning. Yeah, so that's certainly been an anecdote from our work in Alex.
And I suppose what that highlights again, Catherine, is something that was brought up by one of the very first comments, was about the difference in experience of the vast majority of our country and those who are privileged to have access to things like online schooling. And the question that was asked, I think it was while Natalie was talking, was whether in fact the many South African adolescents who already exist with a described experience of instability and danger, would their symptom presentation be more or less than more privileged adolescents? So Natalie, I don't know if you want to comment.
So first of all, trauma activates trauma. And so just because you've had significant trauma doesn't mean that you're better able to handle it. We also need to look at what are protective mechanisms, what are predisposing factors, precipitating factors, and all of them have a mix. So ideally, one would hope that there are certain protective measures in place to help bolster adolescence resilience, but one would presume those with less protective mechanisms would struggle even more. Yeah.
And I suppose what we also have to be very mindful of is the kind of levels of chaos that have been in the country, the levels that might also, of course, be both a reflection of the pandemic and the lockdowns, like an expression of frustration and rage and hopelessness, and of course exacerbate the traumatic effects, I suppose, especially for those kids who were exposed both directly or indirectly, and I think very few weren't, to what happened in the country in the last few weeks.
Absolutely.
But maybe just because there's lots of comment, I suddenly see there are 38 new comments in the chat, but I'll go through them as quickly as we can. But there was a question about thinking about the sort of neurobiology, and are we expecting to see more ADD behaviors emerging in young children, adolescents, due to whether it's routine or screen time?
So in part, it's a little bit early for us to know, because we need to do studies on what this extended extended time online has had, what kind of impact it's had. But one thing is important is to recognize that the anxious brain is not a learning brain. And so a lot of our children are going to be looking like they're very distracted, like they might be engaging in impulsive, dysregulated behavior that may look like ADHD, but it might be actually a lot of anxiety. In terms of, the neurology of kind of extended periods, that I'd be interested to see what that looks like. And then certainly there is research on the impact of maternal stress and anxiety and early and maternal pregnancy and stress and its impact on behavior and ADHD-like behaviors. So unclear still. Yeah.
I suppose it made me think a little bit, and maybe back to Catherine before we move on to some of the adult relationship questions. Are you finding, you spoke about the circle of security and the impact on exploration behaviors and the hypervigilance. Are you finding moms more anxious? And what have you seen, and what are your counselors seeing in terms of the impacts on the baby's exploration behaviors, or kind of any other impacts that you are able to see yet?
Yes, certainly we've run several circle of security parentings in the pandemic, so 3, and we certainly are hearing that parents are hypervigilant, and it is difficult to sort out what is appropriate anxiety and what is then anxiety about situations that are actually safe. So yes, we are absolutely seeing restricted exploration in smaller children.
Yeah. And I was thinking a lot about how so much of it, I mean, both Catherine, everyone spoke about the value and the importance of connection, and how the experience of the lockdown, the trauma, is mediated by the quality of your connections to other people and your support systems. Natalie, two people asked about online schooling. I don't know if you feel equipped to talk about that in terms of emotional development.
It's certainly been very interesting and entrepreneurial by some. But my sense is that humans are social and we're wired for social engagement, and that the curriculum for children is not just based in the books, that so much of the learning happens through experiential engagement with peers, and that there's a lot to say about the social and emotional curriculum that needs to take place, and that's in practice. You can't read about that in the books. You've got to kind of get out there and do it. My other worry is that, my sense is that it might, those that are more prone to kind of social anxiety would be drawn to it. And we know with anxiety, avoidance grows anxiety. And so there's no capacity to practice in safe ways. So my general sense is I think children need to be in the world and not just an online world.
That resonates with me. And maybe that's a good segue into adult relationships, because I mean, the kind of issues that, like, even around how we relate to our extended families through things like Zoom or online meetings and not actually meeting face to face. And I know one of the questions that was sent into us before the webinar was, have you seen any impact on long distance relationships because of COVID, people not being able to travel to each other? Vuyo, has that come up in your practice, your experience at all?
It has come up, Judith, quite a lot, but also I think it has created problems in the fact that people underestimated it. Often people think that because it's a long distance relationship, it should be easier. So there's an expectation that as we go in, we know we are going to have these challenges around proximity. But what we underestimated, I think, is the ability to make the choices that we need to make about when do I see my partner? How do I see my partner? If I wanted to see my partner and suddenly there's a lockdown, I'm not able to travel. What problems does that create in terms of intimacy, in terms of passion, in terms of commitment? And when things that like this happen, like Natalie said, is that when people become anxious, they then were starting to avoid talking about issues. And because they're avoiding talking about issues, people were then sitting on their own, trying to figure it out. And so that's been one of the effects that I've seen with long distance relationships. But also, I think, where people were suddenly in different parts of the world and they were locked down separately. I mean, a lot of people who, when the lockdown started, they actually locked down together, but there were those who sort of were locked down separately, and now having to navigate the relationship, but also talk about the fears that each one is experiencing from wherever they are sitting, and not feeling understood because these things are happening at different times where they are sitting, and their experiences are different. Because if you were locked down in New Zealand back then, last year, the circumstances around that lockdown were different compared to one who was locked down perhaps in Italy or even in South Africa.
Yeah, I was thinking about one of the other areas of conflict, of course, and two people have raised this about when you've got one partner having different rules about COVID safety or about vaccines or different opinions. I imagine that comes to the issues of how couples negotiate and families negotiate conflict, because I imagine that even for parents managing teenagers who don't necessarily have the same understanding of social distancing or sanitizing or safety. So maybe, Vuyo, I don't know if you want to comment on conflict resolution around.
I think what we're seeing now is that relationships where people were managing differences in a healthy way, they almost built a foundation upfront because that foundation fed them well as they were going through this period, versus couples who were already conflict averse and who had issues and had unhealthy ways of dealing with their issues, because suddenly being forced to have to address and attend to issues that people might have thought, you know what, we're not going there, or we're going to avoid this issue because there's bigger problems. I mean, I would even hear people saying, people are dying. There's no time to be talking about sanitizing, washing our hands in our own home. You know, so when the other partner would be hyper vigilant about what needs to happen, the other one almost feels like the world is coming to an end and you busy talking about this. And so, yeah, I think what I've been seeing, especially in practice, is that people have now been forced to start learning. And for me, it's also couples that had become very comfortable with how they've always done things. And now they are forced to start looking at what are healthier ways to deal with the conflict? What are healthier ways to, but already because people are anxious, when they hear even the word conflict or the word disagreements, people already go into a panic. And so their ability to then solve effectively would then be impaired.
Yeah, absolutely. I mean, I think that there's been so much for people to deal with. One thing that's come up, I'll sort of end with maybe one question more for each of you. But one thing that has come up has been how when people have lost a partner, maybe an intimate partner during COVID, what has happened to grief. And we did do a webinar earlier this year on grief and loss, where we spoke about actually how the absence of rituals and the absence of a connectedness to family. So being able to, I mean, for me, I've watched funerals on Zoom and I find them very, very strange. And I don't feel the same kind of grief or connection to that loss than I would if I'd actually gone to the cemetery or to a memorial service. So that has come up quite a lot. But the thing I really want us to also just remember was you raised about what's happened to gender roles. And I think that that's going to be very problematic moving forward. I read a study, in fact, they called this the recession associated with COVID is actually the she-cession, that in fact it's going to disproportionately affect women, and of course always affects women who are less privileged and who are financially more compromised to start. But the World Economic Forum every year brings out their gender gap, their kind of analysis of how women's authority, healthcare for women, women's girls' access to education. And it's still very far. I mean, it was going to be that a few years ago, they said that the gender gap would be closed but within about 90 to 100 years. And this year, when they brought it out in March, they bring it out on International Women's Day, it has gone back 25 years, that the losses associated for women's rights internationally are 25 years behind. And I think, you know, we're a female-dominated audience. We normally get Zamo, who I see as part of our panel, to do this chairing, but I do think that this is something we need to kind of take on. And I don't know if you've also seen that in your practices I mean, you mentioned that women taking on more of the domestic role or household chores.
It has been something that I've seen, and what I've been finding also is that it then causes other challenges, and especially amongst, I'll speak to the population that I service, which is Black. The shift that I've seen is that a few younger Black men have taken on the parental roles, which has been very, very interesting and very nice, because they seem to take on easily to that. But where I've seen the shift in terms of the gender roles has been in all the other aspects, where women still continued to take full responsibility for the household. Where kids are older, women are taking care of the kids. Women are the ones that are going to get groceries. I mean, I remember last year, level 5 and level 4 in my household, I was the one who had to do the groceries, you know, for some reason, and it was not even negotiated. It seemed almost the right thing to do, that I would then do that and then take care of the household, make sure that there's food, make sure, so that,
It's a challenge that we have to face.
It is a challenge, and I think we need to find ways to mitigate for it, because it could be problematic in the long run, in that I think there's other studies that also have found previously that sometimes these stereotypical gender roles are also a catalyst to gender-based violence. or they somehow are connected to gender-based violence, because there's almost this expectation that as a woman, you are going to have to do this.
So it's something I agree that we need to take really seriously.
Yeah.
And but I'm going to go on to another comment for Catherine, which was a question that someone said they've noticed an increase of children being admitted for malnutrition in the pediatric unit. And sorry, if you just mute yourself, I think someone, someone putting a kid. Okay, so someone noted an increase of children being admitted for malnutrition in a pediatric unit. It's both interesting and an unfortunate fact, and about lockdown. And the question is, what advice or strategies do you suggest we implement in neonatal units when visiting of newborns is restricted?
Yeah, the NIDS CRAM report that Mark Tomlinson and others published this year really highlights hunger in homes, and how the bottom line has been, the economic situation in our country has really affected food security and hunger. And yeah, I mean, I think it is devastating that children are going to bed hungry. And the study was also saying that in many families, parents are protecting their children and are encouraging that children eat at their own expense. But of course, one can see the physiological and psychological consequences of that. The question about neonatal care, I think that is a devastating aspect of the pandemic, of restricted visiting for babies in the critical times when they need relationships more than ever. And as Natalie was saying, I think the consequences of that we're going to be seeing. I suppose for this network of colleagues, it's really to emphasize the work that can be and should be done for babies from an infant mental health perspective. And yeah, I mean, we've certainly carried on working at Edenvale Hospital and the primary healthcare clinics in Alexandra, and Alex Clinic, which is the biggest birthing clinic in Alex. And we've been able to go in and support babies in this time, but I think the consequences of that are yet to be seen.
It's sobering. And maybe I'm going to actually bring this to an end. There are 60 comments that probably are worth casting your eye over in the chat. I know Cassie will save the chat and also share with our speakers really the incredibly positive feedback. So many great questions and comments, never enough time, but to respect that we all have lives and families and Netflix series to watch. We're going to come to an end, but maybe to end with something that we've all touched on, is that things are really difficult. And that maybe it was a phrase that was used in a New Frame editorial about the realities of this country. And the author wrote about the importance of facing the future with hope, without illusion. And that's about seeing things for as they are, facing the difficulties with knowledge and with strength and support from our colleagues. And like the Healthcare Workers Network is the most positive thing I've been involved in years. And it's been something that's got me through the pandemic with some hope, but without illusion, because I know it's hard. And maybe just to encourage you all to stay connected and join us on our webinars, support the work of Ubabele, yeah, really to just be connected with each other. And thank you so much to everybody for their time. I'm going to hand over to Cassie, just to also remind you that there is an evaluation you need to fill in. I think the link is in the chat. And yeah, thank you. Thanks so much.
Thank you so much to the speakers and to everyone's time. I've thoroughly learned so much, even just from reading the chat box. We'll definitely be going to them to be making, FAQs and articles. It's been such a rich, conversation. Just a reminder to everyone, we will share the webinar recording as well as the presentation slides via email, as well as uploading it to the Healthcare Workers Care Network website in the next 24 to 48 hours. We did post the link to apply for CPD points. Again, it will be in the email that we'll send out, so you can also fill it in there. Thank you everyone for your time and for your generosity and your expertise and insights. Stay warm, stay safe, and stay connected. Have a wonderful evening. Bye-bye.